I absolutely love attending conferences. They're not just about learning, but they're about the connecting incredible minds with the people who are shaping the healthcare future. And there you meet amazing people, and one of the amazing person is Dr. Dimitrios Kafetzis. I
Correct.
hope I pronounce it correctly.
Perfect.
Yeah. So Dr. Dimitrios is a reproductive and IVF specialist, and his expertise lies in personalized natural IVF treatment. And under his leadership, Orchid Medical Center became one of the leading IVF center in the region. How are you, Dr. Dimitrios?
I'm very well, thank you. Thank you,
Yeah.
thank you. It's a pleasure and honor to be
Yeah.
with you today.
Yeah, amazing. Do you want to tell something about you to our audience?
Yes, myself and the UAE and Dubai. Actually, a few days ago, the 9th of January, I completed 10 years in the
Wow,
UAE. I
amazing.
landed from Gatwick,
Yeah.
9th of January 2015.
Wow.
And as you said, since then, after a brief spell at the Bornholm Clinic, I joined Orchid. Orchid was opening back
Wow.
then, and we started from patient number 1 in 2016, and now, as you said, Orchid is considered to be the most boutique clinic for fertility, and we cover every aspect of our specialty. We work with most of the gynecologists in the private sector of Dubai and the UAE. We are very proud to say that in terms of pregnancy rates and baby rates, we are the top clinic in the GCC, not only in the UAE. And this is not me saying this. I always say that the people to ask are the gynecologists and the pharmaceutical reps who actually go around and see all the clinics and all the doctors. And when they come to us and say, Doc, your reputation is good in this clinic. So makes me happy because it's all our hard work all these years. It's been now, the clinic has been open now for something like 8 years. Our main thing that also touches the topic we're talking about today, our main advantage is the ultimate personalization of the treatments we offer. Meaning from the point of the exact vitamins that the couple need to prepare, preparation 2-3 months before for single women, how can they improve their egg quality, even for men, freezing the sperms, how can we improve that before we proceed to treatment. So all of this is like what we are good at. This is what we are good at, and this is how we got our reputation slowly. And this is why it will last, because we grew on this reputation for so many years.
Exactly. I have heard you in the conferences, and I always appreciate, I have talked to you about that. And I have heard patients when they come back, the feedback, right now I have few patients with you, and they are really satisfied. So when we were talking about that, what topic we are going to do, you said egg freezing is really important. And I see these days, women, sometimes they have to delay motherhood for their career, for their future. They might be achieving the goals which they dream throughout their lives. But then there's a question, then what about the family? So egg freezing is really important. So my patient would want to know what is egg freezing and how it is different from the IVF.
Yes, it's I believe one of the hottest topics at the moment in fertility and gynecology, because it touches all of us. Like for me, I'm thinking, what will my daughter say to me in 15 years from now, that she will start hopefully university, and she will say, Dad, I don't want a baby until I'm 35. And then me being a specialist, I will say, oh, your eggs are 35. So to start with your question, it's something that all girls should be considering until we get a nice alternative, like now going into the imaginary world. At some point, we will find a way to keep a woman's eggs young forever.
Exactly.
And there are trials happening on that, making eggs from stem cells. Actually, making sperm from stem cells has been successful up to a certain point in mice, and they're trialing in humans. That's a different topic. But I'm trying to say that, of course, a time will come where we will not need the egg freezing. But for now, it's our best way to get women to breathe. That's that's the phrase I use when I speak to them. You must not be under pressure. Oh, I have to find Mr. Right. I don't like this guy, but I have to have a baby now because I'm 32 and I'm dreaming of a family of 3 kids. But now I'm already 35. Where's the time to do that? And then here's where we come in. We explain all of that. We have to explain that the process is similar to the first part of IVF. So the whole point is in one go, meaning one cycle, meaning 10 to 12 days of attending the clinic, to have the small operation, the egg collection, which is similar to IVF, see how many eggs are good, freeze them, done.
Wow.
Done. So in 10 to 12 days, a woman has some nice backup plan, has some nice reserve of oocytes, of eggs, as we call them, in the freezer of the clinic. We use these simple terms because freezer means liquid nitrogen minus 200 degrees. Like these huge tanks you see in the movies. But they are there, these eggs. They can stay forever. Going forever, like 5 years, the law says in the UAE, extendable to 10 years. And that's what I always tell them, like, nobody will ever destroy your eggs if you want to keep them. Nobody will write letters to the Ministry of Health to extend even more if needed. But usually when women are like 45, 46, they know what they're doing by their life. So that crucial period, they can move. Now the UAE law is becoming much more flexible, much more liberal. Women, they are in charge of their eggs. They're not bound to their husband like they used to be, and they can move their eggs outside the country, still to use them in the UAE, although the law is changing slowly. We need a marriage certificate or an equivalent paper from the embassies and the Ministry of Foreign Affairs. These are legalities. But what I'm trying to say is it's much easier and it's helpful for the women, and it's not a taboo as it used to be.
Exactly. Now, a lot of Hollywood celebrities are actually speaking about, and Rebel Wilson said that it's like an insurance policy.
Correct.
So, exactly. So, what age women should consider having the egg freezing?
It is, the reality is, there's no age is young to do this. Of course, we must be talking about a person that is an adult, like over 18, 20, but we don't like to freeze eggs in such young ages only because we want the girls to be a little bit more, let's say, conscientious about the future, about what they're doing. But as I said, in the US, that they're much more liberal than these situations, there are girls, and in Europe, who say, look, I'm going to become a doctor, a professional, a dentist, a lawyer, and a finance lady. And there's no way I'm going to consider a family until 35. They enter university and they freeze. Yeah. It's in terms of success rates, and here comes something that we all know from our normal lives. When we are young, our eggs and our sperms are the strongest. Okay? Yeah. So it is much easier. Exactly. And when I'll give you some rough numbers, when we freeze 10 eggs from a lady in her 20s, from those eggs, she might get 3 babies. When we freeze 10 eggs in a woman at 35, we'll be lucky if we get 1.
Oh.
Okay, because and this is a nice way of telling you the misconception that we have that, if I'm eating healthily, which is very important, if I'm fit and I'm going to the gym, means my eggs will be good until I'm 40. No. Yeah. And the sperms, no.
And even freezing eggs is not guarantee that you will have a baby.
Exactly. Yeah. And now that's why we always ask men and women to go see the specialist, because talking about the eggs now, because this has been done now for the past 2 decades, we have exact charts per age group, per AMH level, which is the ovarian reserve level of the ladies, to tell us that if a woman, I'll give you again an example, freezes this number of eggs at 30 years old or 32 years old, and her AMH, her egg quality was this level, when she defrosts, she has 70, 80, 50, 40% chance of at least one baby. And maybe 20% chance of two babies with this number of eggs. So we can give her exact numbers. Because how does this translate? If we give a woman a chance of 70% with a number of 10 eggs, she says, okay, 70% for me is fine. If I ever need those eggs, because there's a chance that she will meet her husband, get 2-3 kids, and she will tell us, doctor, discard my eggs. But if I ever need them, because that's the insurance policy, that's why we get insurance in the car, in case we get in an accident. So if we ever need those eggs, then she has to know, actually, is the number 10 enough? Or should I do another cycle, get a 20 number of eggs frozen?
So bigger the age,
the more we need.
You need.
The more we need.
And
the younger
even
the age,
AMH,
the less we need.
Even the AMH, maybe someone older, but better AMH. So you have exact prediction that...
Exactly. We can give them exact numbers, which we didn't have a few years ago.
Normally it is around 10 to 12% per egg chance.
Yes,
So if
correct.
somebody in right age with right AMH, with 10 eggs, they have almost 100% chance.
Almost. It's not like that. It's over 33, 34. The chances are around like 7% per egg. And we never say to a woman, because your eggs are so good, you're going to have 100%. Because it depends, as you know, in the uterus, the sperms, how it will be when she ever needs those to use those. And also, sometimes the eggs don't defrost as well as we thought they would. We can't do a trial to defrost one and see because they're very precious. So we always keep a backup to say, look, with this number, you might have a 70% chance or an 80% chance or freeze another 10 to go a little bit higher. So but we can give exact numbers.
What is the cutoff normally? Like women come to us and they say, what is the best age we should consider and we haven't find the guy? So is it 35 or 33?
No, we must think earlier.
Even earlier,
30. If we're 30, and this number that I'm giving you comes from, there is not an exact guideline yet on this, but it comes from all the conference, all the studies, everything that we read in our experience. Meaning that if we're 30, and I'm saying a lady, and she's single, and there's nobody in her life that is in a nice relationship that may materialize in a marriage in a year's time, then forget about it. But if we're single and there's no knight in shining armor in the horizon, and she's thinking, well, I would like in my dreams I have 3 children. Then even if we're 30, let's do one cycle because you know this better than me. How many ladies will we see at 35 that the AMH, the ovarian reserve test, is already in the zeros?
Exactly.
Okay, many. Because of the pollution, because of the way we are, because of the food that we eat, because of so many things. So, like, to say 35 for some women will already be too late for the family they're dreaming about.
Because
so
of
we
the
always
job,
say
stress and all those
exactly.
things.
We say from 30 onwards, meaning that in that way we will catch these ladies that at 35 will be too late for them.
Do you offer it before 40 also? Maybe somebody coming at 39. So you
we do even after 40, after 40.
Till what
but
time?
With the proper counseling. Meaning the percentages that I told you change when we are 40, because then the ovarian reserve is very low as a rule, like as an average, and these eggs, quality-wise, when we defrost them, because it's a big stress for the eggs, big stress. So I'll give you an idea. When we freeze 10 and we are in our 20s, then 10 defrost and are usable. But when we're in our 40s, we freeze the same number, but 7 defrost. And then when we inject the sperm, because it has to be the sperm injection, then 6 fertilize or 5 fertilize. And immediately the numbers drop. Because I'm saying this because even we doctors, in our minds, we think 10 eggs, 10 chances for a baby. It doesn't go like that with the frozen. Doesn't go. So we going to what you said, to the example that a woman over 40 will come, we will not deny her, but we'll tell her, look, to give you a good chance of a baby. When you use these eggs, you might need a bigger number. And then, of course, the costs come in and the effect on her life. She will say, doctor, I was thinking maybe one time to do this. But then we might tell you, look, one time may not be enough for you, for a baby. And then we talk about that.
The women, better to have multiple cycles.
More eggs, basically. More eggs, basically. Yes.
So there could be other reasons also, beside delaying motherhood for career. There would be other reasons like autoimmune diseases and the cancer treatments also.
We see that now a lot. We see a lot lately.
You talked about the ovarian reserve.
Yeah.
So age, AMH, what else? Antral follicle count, yeah?
So going back to your question, that's what I was going to say. And thank you for giving me the chance. So how will a lady, how will a woman, how will a single lady know? Okay, we always ask her to go to her gynecologist, not the fertility specialist, and do the fertility checkup.
Exactly.
When we're 30, for example, okay, and we, as I said, we don't have anybody in our lives. Scan in the beginning of the period, day 2 or 3 or 4, count the number of the eggs.
Antral follicle.
Do the AMH in the same visit, and in the scan, check for anything else. Like, for example, if you see endometriosis, means in a few years, if we don't treat it, then these eggs will be much less. The endometriosis will be biting on the healthy ovary. Check for fibroids. Check for anything else that could reduce her potential later. For example, if a woman has to remove 10 fibroids, then immediately her fertility potential drops.
Decreasing.
Maybe not because of the egg, but the chances of a baby. Okay. So what I'm trying to say is, don't, for the girls, that's like one of the take-home messages from today. Don't neglect the yearly checkup, the number of the eggs, the AMH, so that even if a drop starts on the AMH.
At what AMH you would recommend? Like I have just yesterday I had one patient in the clinic and she said, I want to check, and she's 27, and I was surprised that she's too young.
No, she's not. It's a good call. Just to check. Just to check.
So at what AMH you will suggest that they should really consider egg freezing?
We have per age the levels we consider normal. Okay, it's very difficult because we don't have the exact numbers, and that's what is confusing for the general gynecologist. And it's not only the AMH; it's a combination, as I said, of the AMH and the antral follicular count. But for every group, we have the levels that we know. For example, at the level of 30, we don't want to see an AMH level close to 1. We want to see 2 and above, 1.5, 1.7. I'm talking now nanograms, So that for the picomoles, you multiply by 7, because in the UK they use the picomoles. So what I'm trying to say is that the AMH, the general condition of the woman, and the antral follicle count, there are charts, we have charts, and they're available online to say, okay, this is a good level, good antral follicle count. Don't worry for now. Okay, you're 27, you have time. Give yourself a couple of years. Okay, and the same goes at 30, 31, 30. But after 31, 32, it's a time to consider. It's a time to consider.
So till 30, maybe those cutoffs can work for you. But at 30 and plus, they should start
30 plus, before 35, I always raise, when I see when I see couples or friends call me and they say, I always raise the issue. You're single, 31, 32, check with your doctor. Is your AMH okay? If it's on the low side and the antral follicle count actually is the same on the low side, do 1-2 cycles. Nothing is wrong with that.
So if somebody is at 27, they are telling me that they want to consider I should do the evaluation, or maybe that time I should refer to the...
Don't refer, because it's scary. You do the evaluation yourself, and if something worries you, text me, call me. Say, Doc, I have this, and this is the lady. And this is always when I speak to the conferences, I say, my mobile phone is everywhere out there. I only have one. I don't have 3 numbers. Like, text me, all the specialists, text me, please. Text me, like, what do you think about this case? WhatsApp, it's 2 seconds for me to reply, but it might make a huge difference.
This may make a big difference to the women. You said the earlier part of the egg freezing is similar to the IVF. So
I'll
you
explain.
Meant it is hormones role.
I'll explain.
Let's talk about the hormones roles.
So in the first point I make to the ladies is, the question I always ask is, do you know why we're going to give you hormones?
Yeah.
Most of them now, because of your podcast, because of that, they say, yes, doctor, to make more eggs.
Yeah.
Okay? Because if, like basic biology, if we don't give hormones, the body will make only one. Okay.
Yeah.
Why don't we do one? Sometimes we do, but it's too much of a hassle to do the operation
Whole
and give her
procedure.
anesthetic, because the egg collection is a vaginal procedure.
Yeah.
It no cuts in the skin
Exactly.
of the tummy. It's only 20 to 30 minutes.
Yeah.
It's under anesthetic that is considered general, but
Sedation.
it's a heavy sedation. It's considered general by the law, but it's not the classic that the machine is breathing, pushing air in our lungs. We are heavily asleep. Immediately when the consultant anesthetist stops the drug, we wake up, and it's a heavy sleep, which is not something that needs a day in the hospital to recover. After 1-2 hours, if everything goes well, couples can go home. They need someone to take them home that day.
They cannot drive
They
on the
cannot
same
drive
day, but
because of the
next day.
anesthetic. The next day, usually the majority of them with a little bit of cramping, because I'm not going to make everything flowers. There is cramping, there is bloating. The hormones do that, but they go back to work. They go back to work. Oh, the first day is recovery day. And the hormones that we give, contrary to what people think, they have side effects, but mild. Meaning, what are these? Dehydration that may cause headache. And we say drink 2-3 liters of water. Take painkillers. It's fine for the headache. Only the first couple of days. This dehydration is because the body rearranges the fluids and they are between the tissues. So women will say, doctor, I have 3 kilos more on the scale. How is that possible? It's only because the body keeps the fluids in the wrong space and on the scale, but it's not fat. Like women, I kept telling them, you will not get fat in 10 days. Don't worry. And then all these fluids, once we stop the hormones, with a period they will go away. And after a couple of months, it will be back to her normal weight. Okay. And of course, there are complications that we used to have in the past a lot, like the hyperstimulation syndrome, that thank God with the newest developments we don't have anymore. We rarely see hyperstimulation syndromes the way we used to see, because we have now different trigger sorts, more personalized medicine, and the operation itself, yes, it has rarely complications like less than 1 in 1,000 there is internal bleeding that needs the hospital. Less than 1 in 10,000 there is hidden infection in the ovaries.
It's more control these days.
It's things that we know that rarely we may get, and we are always on top to prevent them with antibiotics and things. But usually it's a well-tolerated procedure. That's why millions of women every year around the world do
They're
IVF.
doing egg freezing, So we already talked about how many eggs. It depends on the AMH and the age. So if a woman who stopped periods, so can they have the frozen eggs used if they stop periods?
Yes. You mean eggs frozen from a decade ago to be used in a woman that is close to menopause? Yeah.
Even post-menopausal, they can go ahead.
We can. There we have to face other factors, meaning that to get the uterus back to a working condition, that a uterus that has stopped like being, you know better than me that this uterus will be smaller in size because of lack of hormone. So sometimes we do a month of priming before we don't go straight into a defrosting cycle. But yes,
possible.
It's possible. And these are the stories that you hear that in the past, that, for example, the mother would carry the baby for the daughter if the daughter had a cancer of the uterus and we had to remove it. But the eggs were coming from a younger, and the mother was menopausal. Like the grandmother was carrying the baby. Surrogacy is not allowed in the UAE, but what I'm trying to say is that even a menopausal uterus can hold a baby with the correct preparation. It's a possibility.
So now the question is, if they are doing it earlier, women might be concerned that longer the frozen time, does it affect the quality of egg, and how long? You actually said it can be indefinitely.
Yes, new studies are coming out like every year. Actually, yesterday I was reading just by chance that a new study came out to say that the length of the freezing, that was about embryos, but it's the same technique. The length of the freezing doesn't affect the health of the children. Because this is the question that you're asking, but for embryos. The question that they had in this university, I think it was somewhere in Northern Europe, if an embryo has been frozen for 30 years, will these kids have more genetic issues, more mental retardation? They will do worse in school? The answer is no. They're equal babies as a birth weight, equal like how they do their performance in the school. So if we were going to transform this for the eggs, probably this information will be true when these studies come out. So at the moment, we are not worried about the length of the freezing. And you know why? Because we have realized that in this time that these cells are in these very low temperatures, they're in a dormant state. The cellular activity doesn't happen. So it means they're not getting old. Means that they're not at risk of conditions that we would face if there were some cellular process happening.
Egg when women is holding, that gets affected in the quality.
Yes.
But the same egg, if it's in the freezer, it doesn't have any... It doesn't
go old. It's this paradox. It's this paradox. And you will laugh because you probably know this, but you will laugh because now that we have had embryos that have been frozen for so long, there are women around the world that are carrying embryos that were made before they were born.
Oh my!
This is possible with embryo donation. But imagine if a woman gives birth to a baby that was created before she was born by another couple. Like these are the paradoxes of the freezing to tell you that it's not so much of a problem as far as we know now. As far as we know now.
So you already talked that doing this procedure is not sitting on the flowers.
No.
It has discomfort. It has pain. You talk about some lifestyle modification before starting 3 months prep. So let's talk about that prep.
That's a very good question. Because the ladies always ask. It's like, doctor, how can I improve my egg quality? And then, thank God now with this massive number of studies that are coming out, we know that one independent factor of better egg quality is the BMI, is the weight. So if we are out of the correct BMI, so less than 20 and more than 25, then we have a risk that our eggs, talking about egg freezing now, will not be optimal quality. And this is something we try to ask girls to do. If you want better eggs, take 2-3 months, lose a little bit of weight, go into the correct BMI with the help of a nutritionist, with the help of an endocrinologist, with the help of eating healthily. Then the next question they ask, doctor, okay, which diet do you recommend? And the easiest way to tackle this, not because I'm Greek, is the Mediterranean diet, meaning that we don't like carbs so much, and we say more fruits and vegetables, organic if possible, healthy meat, healthy fish, meaning like more on the organic side, olive oil, and more on the protein and the fibers style than the carbs and pizzas and pepperonis and French fries and processed food. That must be close to zero. On the vitamins, this is also something that I really work on and I really care about because I follow the studies. Sadly, our dream of having a nutritionist in the clinic, in Orchid at this stage is not happening, but I have a list of vitamins that I have worked through my experience the years and through the studies that are coming out that improve egg quality. And many times the ladies come and they're like more educated than me. And they have studied more than me. And I have like vitamin D, for example, is one of the vitamins that have emerged lately because we're all vitamin D deficient. And more studies are saying, actually, if you go out in the sun or get some vitamin D supplements, or ideally both, you might get better egg quality. Then comes ubiquin or coenzyme Q10. The latest from the Americans says NMN, this anti-aging molecule actually makes better eggs and better blastocysts when couples try for a baby, so stronger eggs. And from there, vitamin C, of course, folic acid, the active form, the folate, and ashwagandha and serapeptase, all of that are in the list that we give to ladies. The key question is, doctor, for how long? Should I take it 1 month before I freeze my eggs, 3 months before I freeze my eggs, 6 months before I freeze my eggs. This answer we don't clearly know because we're not sure 100% how long a key factor in the diet will take to improve the egg quality. We need studies on that.
Yeah.
But usually at least a month or two,
3 months.
we advise, yes, we
Yeah.
advise. Ideally 3 months and above.
Yeah. So if somebody just had the frozen egg and she gets married, she conceives naturally, everything goes on normally,
Yeah.
what happens to those eggs?
Good question. Every year, because we have this responsibility to contact couples, women, and say, you have your eggs, what are you going to do with them? And if they say, I want to keep them, they have to pay a small fee, a small rent, as I call it, to make it easier. But some of them will say, actually, it's my embryologist team, the lab that makes these phone calls. They say, I'm sorry, I have now 2 kids. We're not considering another round of woman. I don't want to pay anymore. And then they have to sign a proper consent that they want us to discard it. Many times, if we only have 1 child, we ask them to reconsider. Because things change in our lives.
Exactly.
Yeah, like we have 1 kid, and after 2, it looks like a huge burden. But after 2-3 years, things are getting better. Now I wish I had those
They
eggs.
get better financially and everything.
Exactly. Or the child grows up and says, "Where is my little brother or who is my little sister?"
Exactly.
So we not, unless couples have 2-3 children, when they say discard my eggs, we say, are you sure? Maybe you want to speak to the doctor, and this is how they can stay frozen, as I said, for at least 5 years, extendable to 10 years in this country. Okay. But we are if the couple are sure and they wish to discard, we have to discard them. In this country, just to clarify, they're not allowed to donate them to another couple. It's illegal, and they're not allowed to use them for research. Okay.
And how long they can keep somebody? By the law. Like otherwise it is indefinitely.
Yes.
But by law, how long?
Here it starts with 5 years, extendable to 10 years. And then from there, for more extension, we tell them that we need to write a special letter to the Ministry of Health. And if they get the permission, then
it's doable.
It's doable. It's doable. Under special circumstances.
There's a Bollywood movie in which the mistakenly eggs were used for someone else. Yeah. So that's a question.
This is our worst nightmare. Like when we get nightmares at night, this is one that we confused one couple's eggs for the other, or the sperms of their own embryos. Thank God, the protocols that we use in the IVF clinics globally are very, 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 very secure. Yeah. Very secure in the sense that the accidents of this kind that have happened around the world are so few. We're talking, I only know of like cases that are less than 5. Of course, more have happened, but like meaning that if you judge by the millions of couples that seek fertility treatment, means that it's almost zero for some confusion to happen. Why? Because we have both electronic systems to check that this sperm meets this egg. Otherwise, if it's the wrong code, because the plate has a code underneath the barcode, the alarm will sound. Oh, okay. And that's one. And also, for every step of the way, we have 2 embryologists witnessing. So one says, okay, it's this egg with this sperm, this is the couple, and the other says, yes, I concur, and they both sign.
Like time out in theater, something like that.
Exactly the same. So every step of the way, it's 2 specialists and the electronic system saying yes. And when we freeze the eggs, they're frozen in little straws that have a barcode and a written label. Right. So we all, of course, there's always room for improvements, but yes, we are trying to be as foolproof as possible. Perfect.
So are there any risk in the egg retrieval process?
Yes, I briefly mentioned. The way I put in the consultation is, of course, we give the leaflets, we go through the leaflets, we discuss with the ladies, and I tell them that it is a proper operation, not a small operation. It's not heart surgery. It's not
Yeah.
brain surgery, but it's a proper operation. And I explained, like I told earlier, the risks that are more common, still very rare,
Yeah.
the risks that are less common, and there are risks that we explain in the leaflet that I've never even seen in my career, but I've read about.
Yeah.
But in general, we are worried that the ovaries, when we puncture them through the vagina, we will not see any bleeding coming outside, but internal bleeding may happen. That's one of our worries, but we have ways to tackle that, meaning we will not discharge until we're sure. We have now things like tranexamic acid that we use a lot in obstetrics, that we use also while the lady is sleeping, and it really...
Our scans are also better in detection.
Exactly, detection is there. Like I said, infection we give to everyone, IV antibiotics and a little bit of extra afterwards as a precaution. Right. Before that, we give antibiotics vaginally to sterilize the area before the procedure, so the night before. So we have tricks to minimize the risk of the complications.
Yeah, complications are known, but you have a way of reducing it.
Correct.
So there must be some emotional challenges faced by these women.
Yeah.
So let's talk about those emotional challenges.
Yes, not only that, the hormones and the injections make women even more hormonal.
Yeah.
For example, when couples come, I tell the husband, look, the next 2
Get
weeks,
ready.
be careful. It's not your fault. It's my fault. I gave the hormones.
Yeah.
When the woman is single, it's even more difficult because she doesn't have usually a support group. Yeah. And that's why, and I'm proud of this, that in Orchid we have, not only we work with outside counselors, psychologists, but we have a psychologist who is there all day. Nice. And we always tell the ladies, look, if you don't have anybody at home to talk to, just tell us. We'll get you to see our nurse, we'll get you to see our psychologist, and you can talk about it. But I always warn them that hang in there, like it's these 10 days, it's these 12 days. And after that, you will feel better with yourself that you did it.
Even introducing a psychologist, they will understand and they'll be mentally prepared that, yes, there's something coming. Correct. So it will make them more ready. That's amazing. Correct. You know, I know one breast cancer clinic from my residency time, and they put this psychologist, and I like that idea that they understand somebody knowing the diagnosis of the breast cancer. They may have that aspect.
Correct. That have been there, someone that has been there before. That's the ideal.
Exactly.
The ideal scenario.
So let's talk about the ethical implication of the egg freezing.
I would say that it is something that is becoming a little bit less of a taboo. And the way it is done in this country that we're all proud of to be here is the most honest way. I'm referring to egg donation, which is something that is very popular in the US and in Europe, but in our field, sometimes we think it's becoming a little bit too commercialized. But at the same time, I don't want to talk about that. Egg freezing for fertility preservation, not just for fun, but when a woman has a low ovarian reserve for her age and she really needs to have some backup for a baby later, that is something that is considered now totally ethical, totally within the medical services that we can offer to ladies. It's not exactly yet what we call mainstream, but it is becoming. It is becoming mainstream.
So what is the biggest misconception about the egg freezing that you encounter?
I briefly mentioned it, is the expectations. The expectations. Even if you talk to doctors outside our field, let's say you speak to a doctor of a different specialty, they don't have a clue. They say, 10 eggs, so we have now 10 chances for a baby. But it's the opposite. Depending on the age, it might be 0 or 1. Like I always put to them in a different way. When a couple tries for a baby for a year, it means that the lady has regular cycles, that 12 eggs were not good.
Exactly.
If we assume the sperms are good. So it means that after a certain time of our lives, it takes more than that for a baby. So I tell them, don't be surprised if we collect all these eggs and half of them will not be frozen because they're not mature or they're not good quality. Because that's the biggest surprise. But doctor, I got 10 and now you're telling me that like 6 defrosted and like 1 may be good enough for a baby. How did we drop from 12 to 1?
Exactly.
Okay, so this is something we need to educate couples. But this risk gets less, so we get better results the earlier we freeze.
Perfect.
The earlier we freeze.
Yeah. So we are in the Arab world.
Sorry to interrupt you. The other misconception that I wanted to talk about, and with a little asterisk there, that this is the knowledge that we have now, is that the medication, the hormones that we give may cause cancer. Again, another nightmare of our profession.
Especially borderline ovarian.
Yes, yes. Now, that's a very good point. Thank God, the studies that came out this year, mainly from the Americans, tell us like huge number of couples. We're talking about nationwide studies. So the American Society says, okay, we're going to do all the ladies that we did the last decade, 20 years. How many of those that had hormones got cancer compared to the ones that didn't have hormones? And then they put other parameters like the family history. And as you correctly said, maybe the borderline ovarian tumor,
maybe a possibility.
Maybe, but breast cancer, other gynae cancers, like cancers of the liver, they didn't come up as higher frequency.
Yeah.
Okay, so this kind of let us breathe that we are not causing more harm than Hippocrates said, first do no harm,
Yeah, exactly.
So this kind of helped us work in a little bit of a without our hands, like, or without second thoughts in our head. Of course, science changes. Maybe in a few years something different will come up. But so far, I try to reassure women that doing one stimulation most likely will not increase, according to the studies, their risks of cancer.
Perfect. Yeah. It's such an amazing discussion. We'll have a second episode. And I feel like that we need to have a second episode. And we have a small ritual in our podcast. Mm-hmm. So you'll be lighting this candle. That is an indication that these conversation on She's Well should go on.
Okay.
So
good.
Let's.
It's an honor.
Yeah.
Yes. Great.
Amazing.
Great.
And this souvenir will go with you.
Okay.
Yeah.
Thank you very much.
About
Thank
our
you.
Talks. Yeah.
Thank you so much. Thank you so much.